Hello, my name is Emma Williams, and today I will discuss my literature review topic regarding heel pressure injuries. As an inpatient wound care nurse, I deal with critically ill patients and assist in managing their wounds. Heel pressure injuries are preventable but seem to be a frequent occurrence in my line of work. For my literature review, I want to determine if there is enough literature available to definitively identify what the most effective method of heel offloading is and how we can implement the products into our practice. To introduce this topic, I would first like to talk about the incidence of hospital-acquired pressure injuries, which we will refer to as HAPI for short, and the financial burden on our hospital systems. 2.5 million people in the U.S. develop HAPIs yearly and can be attributed to up to 60,000 deaths annually. The estimated financial burden is $22 million, and a single HAPI can cost a hospital system anywhere from $500 to over $70,000 per incidence. The heel is the second most common site for a pressure injury to occur. HAPI development has a large financial toll on the hospital but can have major negative effects to the patient both psychologically and physically. The occurrence can create a mistrust of healthcare workers and add to further health complications. The interest in the prevention of heel pressure injuries gives way to the following PICO question. In inpatient adults over the age of 60 with impaired mobility, how does the use of soft, upholstered offloading boots compared with floating the heels with pillows or using prophylactic silicone foam dressings affect the incidence of hospital-acquired pressure injuries of the heels? I became motivated to find an answer to this question because, in my experience, heel pressure injuries can evolve quickly and cause significant trauma to the patient. The heel has very little subcutaneous tissue and is prone to pressure, moisture, and shearing forces, which can quickly cause tissue ischemia to the calcaneus bone. This puts our elderly, immobile, and impaired patients at a very high risk of developing this injury, and it is our duty as nurses to do what we can to prevent an occurrence. I use the Sinal Healthcare Database in Maryville University Online Library to conduct my research for the literature review. Keywords heel pressure injuries and offloading elicited a wealth of information. I made sure that I was up to date on the latest information regarding heel pressure injuries and offloading and found 12 research articles on the subject. I then narrowed the selection down to 6 when I excluded articles that were not primary research, were literature reviews, or did not have a control and intervention group. Now, we will briefly discuss the research articles found and the knowledge gained from them. Myers utilized a randomized control trial in an ICU setting to evaluate silicone foam dressings versus pillow offloading. The data showed 0 incidences of HAPIs in the intervention group compared with 7 in the control group. This study, while helpful, had a small sample size of 54 people and limited follow-up time. Yun utilized a quasi-experimental study comparing silicone foam dressings to standard offloading in the ICU. While the patients who received the silicone foam dressings had significantly lower instances than the others, this study was performed in 3 different ICUs, all with different offloading measures and bed surfaces. While the data is positive, the use of what standard offloading consists of was not specified, making one wonder if there is not an appropriate offloading plan in place prior to the implementation of the silicone foam. Gleason performed a quasi-experimental study evaluating HAPI incidents in a hospital system that implemented low-friction booties over a 5-year period. The product used in the study is not part of the PICO question, but shows the importance of staff education and offloading. In this study, there was minimal change in HAPI incidents until mandatory nursing education was performed after a year, and the HAPI incidence dropped by 84%. Barakat Johnson performed a randomized controlled trial in the ICU of heel offloading boots versus standard prevention measures, which was typically pillow offloading. The study had a large sample size of 338 patients and suggested that the boots were much more effective. Lupien utilized a quasi-experimental study comparing plastic-framed boots and soft upholstered boots. This was a retrospective study and showed a 10-fold lower incidence of HAPIs in patients who utilized the soft upholstered boot. Eberhardt studied HAPI incidence in patients undergoing elective gastrointestinal or cardiovascular surgeries in the 48 hours post-operatively with the use of silicone foam dressings compared to transparent occlusive. Research suggested the foams are more effective but would need further studies performed to come to a conclusion. Though the studies were very helpful in determining which products are most popular and effective, the PICO question cannot fully be answered at this time. The studies seem to lean more towards bordered silicone foams and soft, upholstered offloading boots, but there is no current literature comparing the 2 products. However, I do believe we have enough information to narrow down our use of offloading products and do away with pillows for floating heels. The heels can easily slide off the pillow and the cushion can deflate. As far as implementing a plan in an acute care setting, I believe that active offloading initiated on admission is crucial to prevent the start of tissue ischemia of the heels. The nurse needs to be able to identify the patients at increased risk, have access to consistent offloading products and know how to use them, and feel empowered to actively prevent these pressure injuries through knowledge of the Braden scale, clinical assessment, or change in patient condition. I also believe that it would be helpful to initiate two-person skin assessments to ensure that a thorough evaluation is being performed, and a second set of eyes laid on the patient will alleviate the fears of the often overworked and understaffed nurse. The expected outcomes of the implementation plan would ideally be decreased or non existent heel pressure injury occurrence. As a byproduct, the plan would also provide consistency across the board on which products are used and how to use them. When patients don't have the occurrence of this preventable injury, it will increase their trust in the healthcare system and prevent repeat hospitalizations or complications. In order to accurately measure the results, we would need to provide both silicone foam dressings and soft upholstered boots to the staff. Then, retrospectively, review charts to determine how frequently each was used and if a pressure injury occurred. This would give clarity on which product is most effective in order to guide ongoing evidence-based practice. This concludes my presentation. I hope together we can champion the mission to prevent hospital-acquired pressure injuries in the acute care setting. Thank you.